President Trump announced a deal with drugmaker Merck to cut the cost of some medications used for in-vitro fertilization. KTVU's Ali Rasmus explains how the price cut for those popular drugs is tied to tariffs.
The White House says Merck, a German pharmaceutical company, has agreed to cut the cost of its IVF drugs by 84%. In exchange, Merck will avoid tariffs on the other medications it produces.
Other countries are agreeing to it because if they don't, we put tariffs on them, and then they agree.
The cost of an IVF cycle can be as high as $12,000 to $25,000 without insurance coverage.
7 in 10 Americans don't have coverage to IVF.
The discount covers just some of the medications used, not the entire IVF cycle. But even so, the White House says families will save about $2,200. And the president says other name-brand drugs could be next.
Referring to Ozempic or the fat loss drug.
So those are going to be $150 out of pocket for Americans.
They'll be much lower. They'll be much lower. Yeah, go ahead, please.
We have not negotiated those yet.
Right now, Ozempic costs about $500 for a month's supply for people paying cash out of pocket. The president says he wants to leverage tariffs on Danish drug maker Novo Nordisk to reduce the cost to $150 a month. Mr. Trump complained that many pharmaceutical companies charge Americans more for the same drugs compared to other nations.
The number one fertility drug used in IVF is currently 700% more expensive in the United States than the rest of the world. And you know, we're ending all of that.
It is true that in this country we pay on average 3 to 4 times higher prices for the same drugs than these comparable countries. However, these are branded products.
Dr. Mariana Sokal with Johns Hopkins Public Health says when it comes to generic drugs, though, Americans actually pay on average 15% less than other nations. But she says overall there's confusion and a lack of clarity about the cost of these drugs.
The important thing that we should mention here is that prices in the U.S., they are not transparent to consumers.
The same exact drug from the same drug maker can have 2 different prices. One the insurance companies negotiate behind closed doors, and a much higher price people without insurance pay out of pocket.
This really hurts consumers.
As for the timeline on discounted IVF medications, they are supposed to be sold directly to consumers on the Trump RX website by early next year. Ali Rasmus, KTVU, Fox 2 News.